Welcome to the Social Workers radio talk show on WCDB Albany 90.9 FM with co-hosts Dr. Eric Hardiman and Alyssa Lotmore. Here at the Social Workers, we address issues important to our communities with social work students, alumni, and community partners as our guests.
As part of the University at Albany School of Social Welfare, we hope to take social work beyond the classroom and agency settings and directly to the public, because the public is the client. Catch us on air, online, and anytime.
And welcome to WCDB Albany. My name is Eric Hardiman, and I'm here with Alyssa Lotmore. We are the Social Workers, and we have another episode today. And with us we have, well, welcome back, Alyssa. Let's say that first.
Hey, Eric, welcome back. It's the end of the semester, which is always exciting for us because sometimes we have student features, which we are doing today.
Absolutely. We love student features and we love to hear what students are doing. And so today we have with us MSW student, a student in the School of Social Welfare, whose name is Camila Grande. Welcome, Camila.
Thank you. Glad to be here.
Now, Camila, you are one of the students who are doing content area field, and part of that assignment or that project that you're working on is to have a media type of experience. So you created your own podcast, which we're going to listen to after our segment today. And you are also going to be on right now talking a little bit about that experience for you and how you are developing media and communication skills to help you when you enter the social work profession.
Mm-hmm. Yeah.
So let's just start off and briefly tell us a little bit about yourself and what brought you to UAlbany as a social work student.
Yeah. So, well, obviously you said my name is Camila Grande. I was born and raised in upstate New York, in the Schenectady area. I graduated from Brooklyn College with a bachelor's degree majoring in economics. And what brought me to SUNY Albany School of Social Welfare, I think, was probably just finally accepting that I was meant to be a social worker. I realized this, I think, back when I did my first mission trip with my church youth group in 9th grade, and we went to Dulac, Louisiana to help rebuild after Hurricane Katrina, which was, there was still a lot of stuff going on that needed to be repaired down there. So we went, and I just realized that helping people, directly helping people, is what makes me the happiest. And so it'd be probably the best option to choose a career where I'm able to help people every day. And it took me a while to realize this because I actually, I went to school for economics, and that's because my parents' careers, my dad's an engineer, my mom's a social worker, but throughout my life, I heard my dad kind of just alluding to the fact that he thought that you kind of needed to have a career in the math and the sciences to be successful, or that's what I got from it. So I had that in my head for a very, very, very long time. That's why I chose economics as my major, because it was studying why people make choices. It was studying people, but it had that math and science component to it. So it was definitely during the pandemic when that hit, and we had all that time to stop and think and really evaluate life, where I said, you know what, I'm not gonna do what people think I should do or what I think people think I should do. I'm going to do what I know I need to do. And I applied for the program and I got in, and now it's now, and I'm super happy, and I definitely know it was the right decision. So
that's great. So you're a first year MSW student in the School of Social Welfare, and as part of your internship experience that all students do in our master's program, you're also taking a special course where you're learning about public speaking and the use of the media as a technique in social work, an intervention, if you will. So for that project, the way I understand it, you chose to interview a guest about a topic that you chose and to then share it here on our show as a podcast episode. So I'm hoping you can tell us a little bit about who your guest was and why you chose the specific topic that you did.
Yeah, absolutely. So I actually chose, I did 2 interviews. And that's because the topic that I chose is the topic of abortion. And I'm always been extremely passionate about women's rights, especially our right to have complete autonomy over our bodies. And this is obviously like a very popular subject in the public right now and in the media because of all of the recent legislation that's passed in many states banning certain types of abortion, legislation that's getting more restrictive and more demanding harsher punishment. So when I was originally thinking about this topic, I was considering using like a policy angle for the episode. But then I was thinking about it and I came to this realization that there's really so much in the media right now. There's so much use of media on the pro-choice side to rightfully obviously promote fighting against so much of this atrocious legislation that it feels like it's almost becoming the single narrative about abortion, at least on the pro-choice side. And so I was talking to my friend the other day, and she was saying how she saw this ad for the pill abortion that the abortion pill that you can get mailed to you in some states now, which is awesome. And it was saying it had some kind of bubble. It was like showing a woman who was taking the pill, and then it had some text bubble underneath it that said like, it's that easy. And like, yes, that's awesome that it's that easy. But someone who looks at that, who doesn't really have an understanding of what someone goes through in order to make that decision, can look at that ad and say like, oh, wow, that doesn't look very good, because it just makes it seem like it's so easy. They don't have that background to it. So what I was thinking for my podcast is that I think it's really important to talk about the reasons why a person would choose to have an abortion and show like through a real example many of the legitimate reasons for having one. And I also think it's important to discuss some of the health aspects of abortion and address some of the myths that have been cited for reasons for banning abortion. And so I actually chose to do 2 interviews because of the relevance of both of these abortion subtopics. And the first interview is with Dr. Aurora Phillips, MD. And Dr. Phillips graduated from University at Buffalo School of Medicine and Biomedical Sciences. She's a second-year OBGYN resident physician right here in town at Albany Medical Center. And the second interview is with a 26-year-old woman named Olivia, who was using a pseudonym for confidentiality. But a few years ago, Olivia went through the experience of having an abortion, and she was gracious enough to let me ask her a few questions about it. So we talked about what was going on in her life during that time, why she made the decision she did, and what she felt she needed the most from the moment she found out she was pregnant to after the abortion occurred, and among other things. But abortion, I mean, at face value, it doesn't really seem like it could be a social work issue, but it absolutely is. Not only because it involves advocating for social justice in terms of women's rights, but you will hear in both interviews that the topic of support is mentioned and how vital the right kind of support is for a person going through the process of deciding to get an abortion. And I think we as social workers, we need to know how to talk with women and girls or people about this subject. And we need to be able to provide the support that they need, especially in this current anti-abortion political climate, and especially if the individual doesn't have anyone else who supports their right to decide in their own personal life. And I know that, obviously not all social workers believe in the right to abortion, and that's completely fine. Everyone has their own right to believe anything. But I just ask, like, please, if you are a social worker with these views and you're faced with working with a client who is contemplating getting an abortion and she needs your support, I just ask that you at least try to refer them to someone who will be able to provide the support that they need. I mean, the NSW Code of Ethics that we all have to abide by clearly states that the social worker's primary responsibility is to promote the well-being of the client, and that we must respect and promote the rights of clients to self-determination, and obviously avoid conflicts of interest. So I think that both of the interviews can be a helpful resource for someone who is faced with making a decision like this. And just to add really quick, during the interview, Dr. Phillips provided some resources, but she forgot to mention one while we were actually recording, and that is the American College of Obstetrics and Gynecologists website, which is acog.org/women's Health. And that has a ton of patient resources about women's health. And she also mentioned the Planned Parenthood website, but I want to expand on that and mention that the website does have a live chat feature with real live health educators available on an accessible schedule that you can answer. They can answer any of your questions. And the URL to that page is www.plannedparenthood.org/learn/abortion. So
you definitely did your research on everything. And well, it's really great because for our podcast episodes, I mean, that's what you're hoping for, these well-rounded, informed, sort of non-biased type of interviews where it's kind of being able to, like we always say, the public is the client. How do we get information out there in a clear, concise, and engaging way to help just provide resources and hear different perspectives? So thank you for interviewing multiple people and being able to provide resources to individuals who might want to find out more.
Of course.
When you started talking, you said, economics and then social work, and here you're doing communications. You're gaining experience in being able to interview people and how do you best get your message out there? What has this experience been like for you, not only to record your own podcast segment, but then also to be here right now being interviewed yourself?
It's honestly a little surreal. And I really do feel very privileged to be able to have this experience. I never thought that I would just be handed the opportunity to record a podcast. And I really admire people who create their own podcast shows because it's just such a great way to put your passions into action and really influence people, which is so powerful. It's such a powerful tool. And I definitely took this opportunity to talk about a topic that I'm very passionate about. And by doing this podcast, it actually feels like I'm contributing to the fight for women's reproductive rights and women's rights in general. So it feels really good. It feels like, it feels weird because I wasn't expecting this to happen. But I feel like I'm really gaining some really valuable skills and showing myself that I can record a podcast, I can get my voice out there, and I can be successful at it. So I appreciate this opportunity.
So one of the things that we talk about on the show, and that I assume maybe you've been learning in your coursework and your internship experience, is that there's lots of different ways that social workers can utilize the media and can be what we call media savvy. That we don't, as social workers, some of us don't think of the media as a tool that's right at our fingertips. But there's lots of different ways to do that, from writing op-eds in the newspaper to being interviewed on TV to being a guest expert on a panel to doing a podcast or a radio interview. When you look ahead to your future as a social worker, which I'm assuming you're also starting to do now, do you think that you'll continue to think of the media in that way and to use the media to reach the general public about social work issues that you care about?
Oh, absolutely. I've actually had this in mind for a while now, just because of things like Instagram and TikTok. I'm in that generation where all of those social media platforms really started to rise, and now they're just such a valid, important part of our lives, it seems like, or they're really embedded into our lives at this point. And so there already are so many social work content creators out there that are getting their message out into the world. And I look at them and I said, that's awesome. I want to do the same thing. But I never felt obviously these social workers are established social workers that have their LMSW, LCSW, which I'm not there yet, of course, but realizing by doing this podcast that that doesn't matter. I still have stuff to say that's important, and I want to get it out there. So, we're also in a time right now where many issues that social workers address regularly and always have addressed are becoming more popular with the general public. So social justice issues, mental health. And I also think it'd be foolish if we as social workers don't act as leaders in defining the narrative that the public is creating about a lot of these social work issues. It's out there anyways. We might as well be a main contributor to how these topics are being discussed, since we actually know stuff about them.
Yeah, I think you hit on something there about not letting the narrative be written for us, but helping to write it ourselves. And so that's what I see that you're attempting to do with the podcast, and that's really exciting.
It is.
Well, since I'm really excited to hear this podcast. So we're going to air it next. And for our listeners, again, there are going to be 2 segments that Camila interviewed. So be sure to listen to both. Is there anything that you want to leave with us? I mean, I know you just gave some extra resources that weren't mentioned. Is there anything else before we transition to your episodes that you recorded that you'd like listeners to know?
Yes. So this podcast, obviously, it comes with a little bit of a trigger warning, since the topic of abortion can be a sensitive one for some people. And, someone might have some kind of trauma related to abortion. So I just want to put that out there. And the interview with Olivia about her experience of getting an abortion is second. So if you feel like you may be triggered by listening to that interview, you can always pause the audio after the interview with Aurora, or with Dr. Phillips, I'm sorry, and stop the audio before that, and you don't have to worry about it. But also, if you are feeling triggered, there are some resources I'd like to provide. So one of them is an app called Mind Shift. You can just get that at the App Store, and it's like a stress management tool that uses CBT, cognitive behavioral therapy, to kind of help you work through what might be stressing you out. So that's like kind of a quick, easy resource if you start to feel a little bit overwhelmed. And then also the crisis text hotline, which is a free 24/7 support, and you can text or message on WhatsApp. It's HOME, so you text HOME to 741741, and you'll immediately be connected to a trained volunteer crisis counselor. So if you are starting to feel triggered while watching this, those are some resources that you can use, or just stop listening.
I really appreciate you sharing that information, Camila. That's really helpful.
Yeah, of course.
So next we're going to listen to the podcast, and we've been talking for the past 15 minutes or so with Camila Grande, who is a master's student in the School of Social Welfare here at the University at Albany, and she completed her own special podcast on abortion and women's reproductive health issues. We're excited to hear this podcast, and this has been part of her internship experience here at the School of Social Welfare. And we look forward to hearing about your future work and your future leadership in the social work profession. Camila, thanks for telling us a little bit about your podcast.
Of course. Thank you so much for having me and for this experience and opportunity.
So you've been listening to The Social Workers here on WCDB Albany, and next we will hear the podcast.
Okay, I'm here with Dr. Aurora Phillips, and she is going to help us understand some of the health aspects related to abortion. So first, thank you so much for taking this time to speak with me. Like, you're obviously very busy as an OBGYN resident, so this is extremely appreciated. So let's get into it. First question. Just generally, why is the topic of abortion important to you? Like, personally, as a doctor, as a woman, as a person?
Yeah, I mean, I think that this topic is so important to talk about, and to have people who are familiar with it talking about it and getting it out in the open, and having it be something that is okay to talk about and ask questions about. Because I think that so many of the voices that are so loud about abortion are something that I've heard you say earlier, actually, is like, the people making policy on this are people who are super outspoken and don't really truly know what they're talking about. And I think that's really dangerous, because this is truly part of healthcare. So I think that's why it's so important to talk about. So I'm glad we're talking.
Yay! Awesome, and thank you again. Great. So just gonna get right into more of the health related questions. A lot of these questions are based off of some of the biggest and most popular myths related to abortion. So we're just going to try to clear the air here. Tell us what you know. And so the first question is related to health is, does abortion lead to infertility? Is there any evidence?
No. Absolutely not. No, it does not lead to infertility. After having an abortion, I tell people this all the time, like patients always are wondering, like, how long do I have to wait before like I could get pregnant again? Because shockingly to a lot of people who aren't familiar with, a lot of people who get abortions are people who want to be pregnant at some point.
Mhm.
And their reason for having an abortion this pregnancy might be, a reason that not that they never want to have a pregnancy. Maybe they want to have a pregnancy, as soon as possible, but something's very wrong with this pregnancy or something. So yes, you can get pregnant right away. The next month you can ovulate and get pregnant right after an abortion.
Wow.
No connection to infertility.
Wow. That is a huge one. So
yeah,
that's awesome. Great. Awesome. So second question related to health. Are abortions dangerous in any capacity?
I mean, I think any medical procedure, any medication always has risks associated. So like with a medical abortion, there is going to be some bleeding. So yes, you could have some blood loss after an abortion. Nothing near like what you would have after delivering a baby though, like not anywhere close to that. And the same thing with like a surgical abortion. There is still a risk of bleeding. There's a small risk of infection because instruments are going to go into the uterus, which is like a sterile cavity. But overall, really small infection risk. There's a really, really rare risk with a surgical abortion of something called uterine perforation, which would be if one of the instruments like made a little hole in the uterus. Again, like pretty rare. I think probably about 1% of the time that happens. It's more of a risk with like a later gestation. So like a later second trimester type of an abortion. But overall, we're talking about really, really rare risks, especially if you were to compare to the risks of complications from having a pregnancy and a delivery. Your risk of having an infection, having a lot of bleeding, having, maybe not uterine perforation, but certainly like a perineal laceration, like a tear of the vagina or something like that, or risk of having to have a C-section, which is a major, major surgery. Those risks are so much higher in comparison. So technically, yes, there are risks.
And we appreciate the truth. So I like the way that was worded. That's perfect. But it sounds like also when you are having an abortion performed by a trained medical professional, the risks are very low, as opposed to, if it's something that's done illegally by someone who's not trained, your risks are going to be higher.
Absolutely. That's a really good point. Yeah. And I mean, if you were to get a surgical abortion in like a legitimate center performed by a trained provider, you're going to also like get a little bit of infection prophylaxis. You would get some antibiotics to like prevent infection. So that is an important, part of it.
Right. Okay. That's such a big, thing now, because if we're going to be banning abortions in some states or making it super hard, the reasons for getting abortions aren't going to go away. So people are still going to get abortions, and it's just probably not going to be not nearly as safe as it would be if they were able to get one by, a medical professional. So, all right. So perfect. Thank you. Does having any number of abortions increase your risk of getting breast cancer or any type of cancer for that matter?
No. I don't even know where that I don't know where that comes from. That I'd never even heard of that myth before, and I don't know what version of reality it came out of, but I can't even come up with a reason why people would think that. No.
As a trained doctor who went through medical school, cannot think of any scientifically backed theory as to why someone would think that this would increase your risk of cancer. Okay. I'm glad we got that one covered. So another myth yeah, basically, one of the reasons why people are trying to push this ban of abortions is because people say that fetuses can feel pain. Is there any concrete scientific evidence that a fetus can feel pain?
No. And I actually looked into this too because I wasn't 100% sure when I was reading your questions, but everything I've, did a little bit of a like lit review. The only thing I can find is like maybe sometime after 24 weeks, the like pathways that will one day respond to pain at some point might start to be there, but there's absolutely no way to know. And there's no evidence that there's any. No, I mean, fetuses certainly can have reflexes, and I did see that in certain places, and I think that there was confusion at some point that like very like small, like very young fetuses will do reflexive things. But that is not the same thing as like the very higher pathways that actually like sense and respond to pain.
Right.
That's a very different thing.
Okay. Well, that's a relief. All right, perfect. And are abortions painful? Like, is it a surgical process? Like, what is
It
the
depends.
process?
There are different types of abortions. So there are medical abortions that consist of taking either 1 or 2 pills. There can be some cramping associated with those, so that can be certainly uncomfortable for people. There are the surgical types of abortions can be sometimes done like in an office type of place with just some local anesthesia. And it's certainly not the most comfortable thing in the world, but a lot of people do really well with that. Some people have different kind of tolerances for pain, and so some people find it a totally tolerable procedure, and others find it just too uncomfortable. We do also do surgical abortions in an operating room, like under some like deep, heavy sedation to for those people who like can't tolerate an in-office procedure, or for kind of later gestational ages. So, and then afterwards, after an abortion, there is generally like a little bit of cramping type of discomfort. So it's not a completely 100% painless thing ever, but generally it's a pretty manageable, tolerable type of thing. Like people will take some Motrin and some Tylenol. It's not like something that you're like needing, excessive amounts of pain meds to get through.
Okay, that's awesome. Okay, great. And I mean, obviously childbirth itself is pretty painful too, so.
Sure is. Yeah.
We don't have personal experience, but anecdotally throughout, history, I've heard.
Yes.
Okay, great. And so you actually just, touched on this next question or explain this next question is what types of abortions are there? But what can you, actually maybe you answered this as well, like what can you expect physically if you have one, which you said like cramping, you could have a risk of bleeding, but nothing is anything crazy. But is there anything else that you would add to that? Any expectations?
I would say it depends on the type. Like if you were to do a medical abortion, I would expect a lot more heavy bleeding because you're going to take the medicine and you're going to pass the pregnancy afterwards. And so you're going to have a lot of heavy bleeding with that and like passage of tissue. If you were to have a surgical type of abortion in the office, like I said, you would get some local type of pain meds in the office. And afterwards, you could expect a little bit of bleeding, but not super, super heavy, a little bit of cramping. If you were to go to the operating room for either like that deep, heavy sedation or for like kind of a later gestational age type of abortion, which is usually done in an operating room, same thing, probably a little bit of light bleeding, cramping afterwards, nothing that Motrin, Tylenol wouldn't handle. And that's generally it.
Okay, awesome. All right, so that doesn't sound too horrible, I would say, physically. So,
No, I mean, I think most people do really, really well. They cramp for a little bit and then they feel pretty good after a couple of days.
awesome. That's good. That's great. Because probably are going to have to get back to work pretty soon once you.
Yeah, I mean, some people they'll go back to work the next day, and you certainly, I mean, medically, yeah, you absolutely can.
Awesome. Okay, cool. And then what advice would you give someone seeking an abortion as a doctor,
I would say try to seek out like a legitimate source of information,
Mhm.
and don't you know don't listen to these myths first of all, but I think that what is such a great resource is like a local, like a Planned Parenthood type of situation. They have really, really good websites,
Mhm.
and they're really well run, and they have really um, good, solid, like evidence-based information. And so I
Mhm.
think that's a really nice place for a lot of people to start.
Mhm.
Um, and if you go to a healthcare provider and you feel like they're not giving you a straight story or they're steering you one way or the other,
Mhm.
I think that's a huge red flag, and understand and know that. And
Mhm.
if you ever are talking with a healthcare provider and they don't make you feel like listened to or safe, then find a different provider.
Mhm. Mhm.
I think, we're in a part of the country where I think so many of the people around here are really um, wonderful and really open-minded. And even if they themselves don't have like the facility or ability to provide abortions because of whatever their affiliation is, they're
Mhm.
usually really good about like getting you referred to the right place. And I think
Mhm.
around here there are so many places,
Okay.
but I feel, I think that in certain parts of the country, this is probably really, really challenging to find like a provider who's willing to listen to you and talk to you and help you
Yeah.
if this is something you're looking for.
Yeah.
I just feel so bad for like the women in Texas right now. Like, I don't know where they're turning to. It would be really scary.
Yeah. Yeah, absolutely. And our thoughts and prayers are going out with our fellow sisters
Really.
who are dealing with that right now. So I think that's really great advice. And thank you so much for providing those resources too. Very helpful to anyone listening to this. So thank you so much. And just thank you in general for taking the time out to speak with me and giving us some great information. And hopefully some people are excited to, dig deeper into some of these myths themselves after hearing this, and really find out for themselves like what's going on and what actually happens when what are the consequences, what are the risks when you get an abortion. So thank you
Yeah.
so much again
Yeah.
for everything.
Thank
Thank you
you.
for
Thanks for having me.
Thank you so much again to Dr. Phillips. Next, we will talk with Olivia about her experience of having an abortion.
Hi, Olivia. How are you today? Thank you so much for joining me and talking about this kind of tough subject. I really appreciate it. How are you doing today?
I'm good. Thanks for asking. And I'm glad to be helping.
Awesome. Okay, so we're going to talk about obviously your own experience with abortion and having to have one. So I'm just going to ask you a couple of questions and just answer them as you feel you can answer them. So first question is, what was going on in your life at the time of your abortion? So how old were you? What was your employment status like? How much money were you making? If you care to share that kind of stuff, just give me a brief background. What was going on?
So I was 22 years old. I had just moved from New York to Florida, and I was in at the time, didn't know, a very toxic relationship with somebody who is extremely mentally abusive. I had a job down there, but wasn't making great money. I decided to come back to New York just to get away from this toxic relationship with this person. And I came back to New York and found out about, I want to say 3 weeks or so, maybe 3 to 4 weeks being back in New York, that I was pregnant.
Okay. So there's a lot going on in your life at that time, a lot of
Change.
Yeah, and a lot of unknown variables, it sounds like, too. Like,
yes, everything was up in the air. I came back to New York. I was living with my aunt and my uncle. I, at the time, didn't have a job lined up. I was also very sick due to being pregnant. I was very exhausted mentally, physically, emotionally, spiritually. Just had a lot going on.
Mm-hmm. All right, understandable. And it sounds like a lot of people probably have similar situations to your own. So why did you end up deciding to get an abortion? What was there like a, one particular thing or factor, or like just in general?
There were definitely a lot of contributing factors to my decision. A lot of major ones. Just the person that I had gotten pregnant with, I definitely did not see myself being with them. I did not think that he would be a good father figure to this child. He had his own issues. He was also a lot older than me. He was 17 years older than me.
Mm-hmm.
So there was a big age gap there.
Mm-hmm.
Aside from the sickness, me just feeling like ill all the time, like I didn't feel like I could even work, let alone get out of bed. The amount of depression I was going through due to the confusion of everything going on, the move and coming home, living in my aunt's basement, trying to find a job. Also, I was 22 years old. I didn't think that I was ready to do that, especially alone.
Right. That makes a lot of sense. So what it sounds like, maybe, and correct me if I'm wrong, is like you really didn't feel like you had the resources or the support or even just the mental or physical or emotional capacity to be able to carry a child full term and then take care of this child for, its infancy and then basically for the rest of, its childhood.
Yeah. I mean, I figured I can barely take care of myself right now, and I don't see me being able to take care of another human life.
Right. Okay. That's a really good point that you bring up. So what do you think, or actually I would say how, like on a scale of 1 to 10, 10 being the easiest and 1 being the hardest, how easy was it to get an abortion?
So being back in New York made it a lot easier, and I'm grateful that, I made the move when I did, because had I been in Florida for that, it would have been extremely difficult. I did look into, there was a period of time where I was considering going back down to see this person, just because I was very confused and everything kind of happened overnight. Basically, this move and everything. It was just a very quick decision to come back. But I thought about going back down there, and I looked into, the closest Planned Parenthoods, if they would accept my insurance. That was New York State insurance. They would not accept my insurance. And I think the closest Planned Parenthood was like a 6-hour drive from where I was living in Florida.
Wow. Oh my gosh.
It being a very conservative state.
Right.
So, not to really bring politics into it, but it's true.
Politics are everywhere. So
yeah. But, I was very grateful to be able to just make a single phone call to the Planned Parenthood that is about a 10-minute drive, if that, from my house. And they were very welcoming. They have you come and do a consultation, and just to make sure that you are making sure that you think you're making the right decision. They kind of, if you have the time, depending on how far along you are, they give you that time to okay, we'll make another appointment. And if you change your mind within the meantime, then we can make another appointment for you to get your prenatals or whatever you want, or to go through with termination.
Okay.
So everyone's very welcoming. They had counselors that you could talk to right there for as long as you wanted to. Just very, very grateful
Okay.
to be able to have that. It's very important.
Awesome. That's awesome. So yeah, that's really great, especially for maybe people who might be considering choosing that as well, to terminate as opposed to carry to full term. And so would you say like maybe it was like an 8 or a 9 now that you are back in New York of easiness?
Yeah, I would probably give it like 9 or 10.
Okay, awesome. And then in versus in Florida, it would be like a
It was
1 or
negative. An option.
I mean, basically.
Like, and from my perspective and with my personal situation, I would have had to pay out of pocket and travel about 6 hours to even, potentially go to this place and not feel welcomed,
Right.
or to,
Yeah,
not know what the situation is.
Yeah, definitely. And just like the cost of transportation to get there, and food and just the regular stuff, like that's a long trip. So like potentially staying overnight.
Also feeling sick in the meantime, that car ride, like there's just a lot to it.
Right, absolutely. Yeah. And I do like the way that you brought in the politics too, because we're bringing you're like, oh, I should not bring politics into this maybe, but like that's what's happening right now is politics are being put into our bodies. Like they are deciding what we can and cannot do. So our wombs are already politicized, and they have been since forever, basically. So
yeah, absolutely.
I appreciate you bringing that up. So what would you say, it sounds like you did have a decent amount of supports, at least through Planned Parenthood. They were able to provide counselors and things like that for you, give you like a waiting period and made you feel welcome. But what else do you feel like you would have needed most when you were going through this in terms of support or resources or anything really? Like,
I had an abundance of support from the friends and family that I did choose to let in on this information. But unfortunately, the person that I was with in Florida and who had gotten me pregnant was not very supportive and very negative about everything, because he was so much older than me, and he wanted a family and was trying to convince me otherwise, which almost worked for like a minute. And then I snapped back into reality and said, absolutely not. Like, what are you thinking?
Yeah.
But it's hard to, in that situation, it's like, oh, well, what if? But at that point, I'm like, you could say what if about anything.
Yep.
So
yeah, that's so true. That is so true. So do you think that like the support that you got from your friends and family and the people that you decided to let in, that was like very instrumental to you being able to handle this and like still, come out being okay?
Yes, absolutely.
Awesome.
And I continued to receive the support even after the termination. Like,
that's awesome.
It's very important to like, because afterwards, you start to think like, oh, did I make the right decision? Or, like there is a little guilt, but you have to like have people around you to be there to remind you, you made the right decision.
Yeah, absolutely. Because they care, and those are the people that obviously care about you, and they want to see what's best for you. So
right. It's good to have outside perspective.
Yes. Yeah. Okay. Perfect. Yeah, I agree. For everything, so that kind of also, you also just touched on this a little bit, but like, how did you feel after your abortion, like in terms of emotions? And
I felt relieved, to just finally be able to put it behind me. I was able to eat normally again. I felt I was less depressed. I immediately got a job, started working full time. I just felt normal again. I felt less crazy, and was able to, after that, completely cut this toxic relationship out of my life with this person.
Mhm.
Like that was the only thing that was kind of keeping me attached to
Right.
this person and the situation,
Yeah.
was the fact that like I was carrying his child. And once that was over, I knew like I made the right decision and
Yeah.
I could cut him out of my life.
Yeah. Yeah. I'm definitely glad that that's what ended up happening for sure.
Me too.
Okay, perfect. So I guess the last thing, just to wrap it up, I really appreciate, like I said again, like that you're sharing all these intimate details and all this information. This is obviously a story that was really difficult to go through during the time. So I really do appreciate you opening up and explaining this to everybody, and especially for the people that are going to be listening, so that they understand why it's important to have access to abortion. So what advice, if you have any, would you give to someone who is seeking an abortion?
What advice would I give? I would say to, just keep the people that are closest to you, and that have like your support system close to you, and to, just stick with your gut feeling, your intuitive gut feeling. Never feel like you're alone, because there are so many people that are dealing with similar situations or even worse situations than your own. And to, if you have access to it, be grateful for that, because there are a lot of people that I even personally know that do not have access to that and have had to resort to very scary situations and could have put their own life in danger in order to not bring another life into this world that we live in, because they didn't feel they had the means and necessities to take care of what they had to.
Right. Take care of another human life, which is not a small thing. Like,
right.
so.
And to also bring another woman into this world who they're going to be controlling their bodies as well.
Right. Yeah.
And not have a choice. Like, it's very important to have a choice. And that's why more people need to speak on it and be educated about it, which is why I'm so happy to be like doing this right now.
Awesome. This is great. Well, that's awesome advice too. Support systems go a long way. And hopefully it will be helpful for somebody who might be going through a situation like yourself, like you had gone through. So I thank you so much for taking your time and talking with me, and hopefully helping other women or people who are looking to have an abortion. So, or basically take control of their lives. You could say it like that too.
To keep our rights.
Right. Okay, perfect. So, thank you again for your time. You're strong, you're awesome, you're doing great. I'm proud of you and all the things that you've accomplished since that happened. And
well, thank you. That means a lot. And thank you for asking me to do this, because it's also something that, like, yes, it's behind me and it's in the past, but like, it's also something that I don't ever want to forget about.
Right.
Because it's kind of shaped me into who I am, and shaped like my beliefs, and like changed my perspective on a lot of things. Not that I ever thought that abortion was wrong or anything close to that, but it made me stronger at the end of the day, to say the least.